At Masaka Health Center in the Masaka sector of Kichijiro district, many residents that have come to treat various ailments are seen waiting in lines this morning. Among these include those that have come to test for COVID-19. I started feeling nauseated and dizzy with body aches while I was at work, so I came to the hospital to see a doctor, but I found many people. We were seated with no social distance. It's possible for someone to breathe close to other or even get in contact with them. Due to the large number of people that seek services from this health center, Kuzeyimwene Anastase at Masaka Health Center says they are also concerned about the risk of infections. If this continues, the risk is big because some people can get infected, but we are also doing everything possible to see that they are not received at the same place. But it requires for us to be present all the time. But we continue to explain the need to practice social distancing. Health center administrators say that hospitals and health centers need to put in place ways to differentiate those who come for COVID-19 tests and those that come to seek other services. Where those suspected to have COVID-19 are tested from separately, but they use the same hallways with others, which means it's possible that if an infected person and those who aren't infected cross paths, there is a risk of spreading it. The space where our hospital is built is small and the building is small. We ask a special place, perhaps a tent, is set up differently so that those that are suspected of having the virus are worked on separately. On the other hand, some of the health centers in Kigali City say they have put in place measures to prevent those that have come to test for COVID-19 from convening in the same place with those seeking other services. We have a person responsible to allocate the people differently according to what service they want. If someone has the symptoms and those that have come to voluntarily test are received separately and directed to where they are supposed to test from and given services so that they go home early. The Rwanda Biomedical Center officials say that the issue had been addressed and the measures should be put in place. Instructions have been given to ensure that the patient who goes to the hospital with COVID-19 symptoms do not come near others who have come to other treatments, so that there would be no spreading among them, how to sit before meeting a doctor, and there should be a distance. For those being suspected for having COVID-19 should be given a special care so that they won't meet other patients. Health centers are accredited to test COVID-19. This was done to recognize the new cases early. It's almost a year since COVID-19 was first detected in Rwanda. More than 16,000 cases have been recorded, with more than 11,000 recoveries and 210 deaths so far.